Good morning, everyone. It is my distinct pleasure to warmly welcome you to CRAN's fourth annual Pan-Tumour Biomarkers Conference. We sincerely hope you will find this event to be informative and engaging, and we are delighted to host you. My name is Cassandra Macaulay, and I will be guiding you through this conference programming for the next 2 days. Through my role as the Chief Research Officer at CRAN, I work broadly across our organizational pillars of support, education, and advocacy, and lead our research and policy-based initiatives. It is my absolute pleasure to amplify patient voices and work towards improving cancer care on behalf of Canadian patients and their caregivers. This year's conference theme is focused on proceeding towards the establishment of a national strategy for advancing comprehensive genomic profiling in metastatic cancer care through the alignment of patient, clinical, and policy perspectives. We have over 60 experts and thought leaders joining us over the next 2 days, which will be filled with enlightening learning and discussion. I would like to begin by acknowledging the Indigenous peoples of all of the lands that we are on today. While we meet today on a virtual platform, I acknowledge the importance of these lands, which we each call home, and where we live, work, and play. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. Further, this recognition and respect for Indigenous peoples and their lands is an important step towards reconciliation. Please take a moment of reflection to acknowledge how we can each, in our own ways, try to move forward in a spirit of reconciliation and collaboration. For those with whom we may not be well acquainted, I'll just take a moment to introduce ourselves. The Colorectal Cancer Resource and Action Network, or CRAN, originated as a grassroots colorectal cancer information and support group back in 2006, after the passing of our president and CEO's father, who had been afflicted with widespread metastatic disease. Today, CRAN has very proudly become a national, not-for-profit, patient-focused organization. We are governed by an experienced board of directors and counseled by an expert medical and scientific advisory board. At CRAN, we have 2 patient advisory councils, and our members' past experiences with the disease help to inform our program development to ensure that our services and initiatives are relevant and meaningful. In terms of our mandate, we champion the health and well-being of Canadians touched by cancer and others at risk of developing the disease. And we do this by providing support, education, and advocacy to patients and their caregivers to help improve quality of life and longevity. Of relevance to this conference, CRAN has expanded our patient-focused mandate to serve multiple tumor type patients with the ultimate mission of reducing the burden of cancer in Canada. We have a diverse audience joining us throughout the conference, and as we get started today, I think it's important to just level set a little bit with some of the terminology which will be used frequently throughout the event. There is a medical terminology reference document as well that can be found as a downloadable resource below your video stream. So when we're talking about cancer treatment, and within the context of this conference, biomarkers refer to the genetic mutation, alteration, protein, or another substance that's driving a person's cancer. And it's really like a genetic fingerprint of an individual's tumor. Biomarker testing is what allows us to identify these mutations or read that fingerprint. And it really sits at the center of personalized medicine as it provides the information needed to target drug treatment. But biomarker testing often is not done efficiently or comprehensively, and relevant biomarkers can be missed. And this is where comprehensive genomic profiling, or CGP, comes into play. CGP refers to a test that assesses hundreds of genomic alterations, or the biomarkers, and it can be utilized to help inform the best treatment decisions. It can improve access to clinical trials, and it can drive value in the healthcare system. So now that we've clarified some of that terminology, let's get into the conference itself. CRAN's annual Pan-Tumour Biomarker Conference series has evolved over the years. Each year's programming builds upon the previous outcomes, expert-informed calls to action, and unmet needs identified by the pan-tumor patient community. We have a little saying here at CRAN that there is no point in hosting a conference if you don't intend to do something about the outcomes. And a hallmark of our scientific conferences is to capture those outcomes through a peer-reviewed publication, which then serves as the basis for our ensuing advocacy efforts. And we will most certainly continue with the same strategy for our 2026 event. We've structured our conference this year around two complementary themes. Today is centered around establishing a national strategy for CGP readiness. Tomorrow, we'll focus on advancing that vision through clinical evidence and the patient voice. We are welcoming a large and a diverse audience to this event, and I am humbled to say that almost 700 of you have registered. We are so proud and so grateful for your participation today. Whatever your personal or professional background may be, we are so happy you're here. So on the docket today, we will begin with a warm welcome from CRAN's President and CEO. Philomena will be joined by Eric, who will share his lived experience with metastatic colorectal cancer. Dr. Stephanie Snow will then join us to revisit the key learnings that emerged from CRAN's 2025 conference, followed by a keynote presentation exploring the economic and health system readiness that is required to support the integration of CGP across Canada, and that will be with Dawn Husserow and Eddie Nason. During lunch, we invite attendees to join the Merck Virtual Networking Room. This is an open, drop-in networking space for attendees who wish to engage in discussion regarding biomarkers, precision medicine, and the future of cancer care. After lunch, Dr. Laura Weeks from Canada's Drug Agency will present an overview of the new framework for equitable access to biomarkers. Building on that discussion, a multi-stakeholder panel will then reflect on the framework and share their perspectives. Following that, we are honored to bring you a patient panel, wherein some really remarkable individuals with lived experience will share the impact that CGP has had on their own cancer experiences and treatment decisions. After a short break, we will dive into a great discussion on the role of molecular tumor boards in biomarker-driven care. And the last session of the day will feature both industry and health system leaders as they discuss the role of collaboration and partnership in advancing equitable access to CGP across Canada. I will take this opportunity to express CRAN's immense gratitude to the 2026 Biomarker Conference Steering Committee, who have graciously, expertly, and thoughtfully guided the development of the conference programming. Dr. Shantanu Banerjee and Dr. Monica Krzyzanowska have kindly served as the co-chairs for this year's steering committee. They have been joined by Dr. Meeta Manna, Dr. Doha Atani, Katie Hulan, Dawn Husserow, Dr. Georgia Balcevich, and Matthew Broham. A great big thank you to all of our steering committee members. CRAN is incredibly thankful for our 2026 conference sponsors, without whom we simply cannot bring this event to fruition. Thank you to our platinum sponsor, Merck, our gold sponsors, AstraZeneca and Johnson & Johnson, our silver sponsors, Astellas, Illumina, Incyte, and Pfizer, and our bronze sponsors, Amgen, Bristol Myers Squibb, Eisai, GSK, Novartis, and Servier. We are also incredibly appreciative to be able to collaborate and partner with a number of patient organizations who come together with one collective, resounding voice to amplify key messages. This year, we are grateful to our colleagues at the patient organizations depicted on the screen who have supported our 2026 Biomarkers Conference. Change is more impactful when we work together, and we are quite privileged to have the opportunity to work with so many who support our mission. CRAN is also very excited to bring forward a new feature this year. We are now offering live translation throughout the conference into more than 60 different languages. To utilize the live captioning, simply select your preferred language in the live translation feature in the bottom right-hand corner of your screen. If you're viewing on a mobile device, you may just need to scroll down on your phone to find this feature. Some additional housekeeping notes. The agenda, definitions, reports, and more are available through the downloadable resources button below the video stream. You can also visit our conference website at any time to see speaker bios and learn more about the programming and our partners. As well, we invite you to join the virtual networking room during the health break. You can join by clicking that button on the screen there at 11:45 Eastern Time when the room goes live. Now, the conference is being recorded, and all registrants will receive the recordings. Viewers are muted. However, we do encourage your engagement throughout the sessions, and we welcome you to submit questions and comments by typing them into the questions bar below the video stream. We will address as many questions as time permits live with our experts, and we'll also endeavor to follow up after the conference regarding any questions that we did not have the opportunity to address. Also new this year, we will be sharing select comments and questions through our new web wall feature. Kindly note that not all comments will appear, and for those that do, your name may appear beside any question or comment. We are really excited to increase audience engagement through this feature, and we can't wait to hear from you. To access or to hide the web wall, you'll just need to click the gray box with an arrow icon at the center left side of your screen. Should you require technical assistance, it will be provided by our web hosting server Digicast via the help button in the bottom right-hand corner of your screen. We invite you to join the conversation and share your reflections and key takeaways on social media as well. Please follow and tag us at CRAN.org and add your voice to the conversation using the hashtag biomarkers26. Our comms team is working diligently behind the scenes to keep these conversations going online, and we'd love to hear from you through our social platforms as well.